Welcome,
Sure.
everybody. This is the Tuesday, December 9th meeting of the Advisory Board of Health 2025. It's 5 p.m. We have 4 members present, and Mindy. Our first item of business, according to the agenda, was to approve the meeting minutes from June 10th and September 9th. I'm almost positive we approved the June minutes in September, but it can't hurt to approve them again. So they have been circulated and they have been online. Any issues on either of those? Okay, I will accept them as approved. The second item of business is the report from Mindy. So report from DOH. Go ahead, Mindy.
Ready? Okay, everybody. So I have a list here. I'm just going to kind of walk through some updates on the department. So the first one being staff update. The part-time nurse position will be reposted with a new emphasis on potential for hybrid work. The position is only 12 to 15 hours per week, and the town, myself included, has conducted 2 rounds of interviews with no successful candidate to date. So I'm trying to rework the job a little bit to make it more enticing, hopefully. As far as the budget for fiscal year 27, it's been submitted. The health department expenses and revenue remain relatively consistent. Notable requests include a health department vehicle as part of a capital plan and a new full-time position. This will be a new position that is a sanitarian and a health promotion planner. So I'm trying to do some more things in line with health promotion and health education work. And this would replace the existing part-time food inspector that only does one singular act for the department. So the thought process behind advocating for a new full-time position is that they could do some of the regulatory work with all the growth happening in town. And they would also be able to do some programmatic work for us too. So we'll see how that goes. DPH reporting, so State Health Department, this is the end of the calendar year, and there's several deliverables that are due to State Health at this time. I will call out 2 major ones, and they include the EPA Beach Water Grant and the local health department annual survey. So those are just 2 big things that require a lot of time. Open Gov update. We are now live on this new system. I know we've been talking about this for a while, and our goal is to gradually onboard all permitted establishments in 2026. And I just want to thank my staff for their dedication and hard work through this transition. Like anything, there's some growing pains. New process can be difficult, and their commitment to implementing this has really been valuable. We currently are active with all of our land use, our septic work, our wells, the plan review process, and for food establishment renewals. This transition will help streamline health department operations, increase accessibility, and improve efficiency across the permitting and inspection process. So in both of those realms. For food renewals, which this is the first big batch of people that we've had to go into Open Gov and create profiles and then renew their annual food permit for this next year. Will take place through the portal. This will, again, streamline the annual payment and permitting process for all 185 permitted food places in Darien. This does not include seasonal places, i.e. Snack bars and at the country clubs, the pool bars, those are permitted seasonally. So we'll at least get them in there with, creating profiles so it's easy for them to go in and renew and apply for permits. As of today, I think Penny told me there's 97 places that are in some stage of applying, which is great for this time of the year. I think not sending out paperwork, having them fill it out and return it, having someone in our office needing to review that and process payment is really expediting food renewals this year. So I'm proud of that. So we're really on track. The Community Health Needs Assessment, the 2025 Stanford Health Community Needs Assessment is complete and is available for review on the Health Department website on our homepage. It was presented in a community forum in September and to the Human Service Planning Council in November. So it's been presented twice in Darien. The CHIP development is underway. I am part of a subgroup looking at access to care. And Allie from Human Services is in a subcommittee looking specifically at behavioral health. Our vaccine clinics, we partnered with Stop and Shop this year, and the pharmacists came to the town, and we were able to provide 90 individuals with vaccine, totaling 124 vaccines. So some folks got shingles and flu at the same time. So again, 90 people were vaccinated with a total of 124 vaccines given at the 3 departments that we hosted. 3 clinics, I'm sorry. October and September. We had 2 in October and 1 in September. That includes town hall employees. APH meeting, I represented the Darien Health Department for the first time at the American Public Health Association's annual meeting in early November. That was in Washington, D.C. Unfortunately, that was during the government shutdown, so there wasn't a lot of extracurricular activity in the evenings because everything was pretty much shut down. But there's more than 12,000 public health professionals in attendance. It is by far the largest conference I've ever been to, with a lot of academia present. It was very invigorating, and I was happy to get the chance to go. Community presentation. On November 16th, I co-presented at the public library with Bill Cavers from the Coastal Commission, and our presentation was Coastal Water Quality Report for the town of Darien. My specific role in this was looking at the principles of beach water monitoring, what our statutory obligations are for monitoring bacteria level, and I provided some details about our seasonal testing program. The goal of this was really the first time this has ever been done, but it's a collaborative effort looking at some of their citizen science efforts that they're doing, and also, the regulatory component of how we're safeguarding our water courses here in Darien. So I think that it was a good opportunity to engage with the community and share that relevant data. An intern project, the health department is planning for the first time ever to host interns with the Connecticut Health Department internship program. This is kind of new. The program is directed by the Office of Workforce Development in the State Health Department and administered by the Office of Public Health Practice at the Yale School of Public Health. So I have a couple of candidates that I'm getting ready to interview. One is from Yale University, one is from the University of New Haven, that are both interested in doing some work here over the spring and possibly into the summer. So the spring internship would begin in February and a summer session would begin in June. And that would mostly be kind of a hybrid type thing where they would be doing some stuff off site and then they would come and engage in the office to kind of get an understanding of what we do in local health. That's all I have for my report. Again, thank you for your support over this past year. It's really appreciated. And I want to wish all of you a healthy and happy holiday.
Thank you, Mindy. Any questions?
Well, just a follow-up on the internship. Will there be any synergies with the potential for a high school student to do a senior internship?
Possibly in the summer, I was thinking, because I think, Mac, that's usually when they're available. So I'm definitely open to that. This is just the first time that I've ever been involved with the state program, and they have some workforce development dollars that they're actually giving students a stipend of $3,500, which is really great until the CDC grant fund runs out. So I'm hoping that whoever we get for the spring is able to tap into that stipend, which is great. And then, yeah, obviously open to any possible high school students in the summer. Whoop.
I have a question about the shingles, the vaccination clinic. The shingles is a 2-part series, and how are they handling that? They came from Stop and Shop, the pharmacist or whomever, and then what do they do if that was their first shingles? What do they do for the second one 2 months later?
Okay. Yeah, so we did crunch the numbers on that, and it was going to be the pharmacist to decide if there was enough to merit having another clinic. And I think there was around a dozen, I want to say. So we're advocating to bring him back again and really target those dozen people that received it to get that booster. So that is in the works and it's on the radar, but it won't be until next year.
But so the people who got it in the fall, and they should probably get another 2 months. It wouldn't happen this year. They'll have to go to the pharmacy, or
well, they could go. So the pharmacist is out of Wilton, so it's convenient. It is very close if they wanted to go there and actually get the second dose. But that list is being, and Most of those folks got it at the end of October, so they wouldn't be quite due for that booster shot, but we are tracking that.
Yeah, like the end of December. Yeah, whatever, beginning of the year. Okay, great. Thank you.
Anything else? Okay, so I think also on the agenda is the future of the ABH and the 2026 meeting schedule. We are currently scheduled to meet on March 10th, June 9th, September 15th, and December 8th. I'll send that out in the meeting minutes. There is still some discussion with the first selectman on the future vision and makeup of the board. So that's, I guess, in discussion still, but we haven't really heard much about that. We will follow up with that. I know, Mac, that you are going to be rolling off in your role because he is here because he's awesome and we love him. But
thank you.
But technically, you are the
liaison
with the Health and Safety RTM subcommittee. I think there's going to be another person taking that.
Well, the new chair of the Public Health and Safety Committee, her name is Violet Adea, and I've let her know about this. So I think she might be reaching out to you, Kevin.
Okay, good. Okay, perfect. And there's nothing we can do to entice you to stay on as a at-large member.
Well, I just thought I suppose that's a possibility, but I just felt it really should be somebody who can go right back to the committee.
Okay, that's super. So we'll talk about that in the coming couple of weeks. Otherwise, I think that's it. It's 5:11. I'm not sure this is a land speed record, but close to it. I want to wish everybody a wonderful, healthy holiday, and we'll talk to you all very soon. Thank you very much, gang.
Great. Thanks, everybody.
Cheers all.